Hello everyone. My name is Garima and I'm a part of the newsletter team at NHN. So for all of you who are joining us with us for the first time, I will share an introduction about the Neurohumanities Network. The Neurohumanities Network is a global community. Um, the slide got shifted. Yeah. So, the Neurohumanities Network is a global community that explores the intersection of neuroscience with arts and the humanities, creating conversations that not just help us understand about the science of the brain, but also about the human experiences that are connected with it. And next slide. We sincerely thank our sponsors, with whose generous support all these initiatives have been truly possible. We are an expanding team and we are deeply appreciative of all the team members who have been working hard behind the screens and have helped bring all these sessions to life. You can connect with us via our social media platforms or even visit us at our official website. And with that, I introduce to all of you today's event, the Mozart Effect in Epilepsy. It's a fascinating topic that explores the relationship between music and epilepsy. And it's truly an honor to introduce our speaker for today, Dr. Natalia Erlich-Malona, who's an assistant professor at the UMass Chan Medical School and also a board certified epileptologist and neurologist at the UMass Memorial Medical Center. She has trained, she has been medically trained at Tufts University, followed by residency and fellowship at the Brown University. And what's truly remarkable about her journey is that she's a professional pianist and has trained at one of the most prestigious institutions, including Juilliard and the New England Conservatory. Thank you for thank you for being with us here today.
Thank you so much for that introduction. Does everybody hear me?
Can hear you well.
Yes.
Okay, great. So my name is Natalie Erlich-Malona. I'm going to be talking about the Mozart effect in epilepsy. And yes, you could say I'm uniquely qualified to give this talk because I used to be a professional pianist. So I transitioned from spending most of my time reading sheet music like that to spending too much of my time reading EEGs like that one below. I'm going to be talking in the first half of the talk about the literature behind the Mozart effect and in epilepsy, and then in the second half explore possible mechanisms and my own thoughts as a musician as to what might be behind the effect. So just some basic terminology. I'm going to be talking a lot about EEGs.
Natalie, are you sure you're sharing the screen?
Yeah,
I
I'm not sure we'll see.
was.
I think you
I
should
thought you
try
saw
to
it
try to
before.
reshare it. Yeah, I
You
think
have to reshare.
we lost it because when we're doing our intro.
Okay.
Stay tuned, everyone.
Do you
Excellent.
see it now?
Works perfect now.
Oh, okay.
Thank you.
So you missed my fun slide of sheet music to EEGs. All right, so I'm going to be talking about EEGs, or electroencephalography, which is a test we do by putting electrodes on a patient's scalp to look at the electrical activity of their brain. And what we're usually looking for when we do this test is not seizures, but these interictal epileptiform discharges, or IEDs, which are abnormal discharges that let us know that a person has an underlying epilepsy or risk of seizures. Of course, sometimes we see many of these discharges, and when they occur rhythmically or periodically, at a certain frequency, then it might actually represent an electrographic seizure. It's interesting to note that the word ictus is found in both music and medicine. In medicine, it's a stroke or seizure. And in music and conducting, it's the indication of a musical event, like the beat of the tempo. So the first physician to write about the possible effects of Mozart on the brain was the French otolaryngologist and inventor Alfred Tomatis, who in 1991 published a book explaining his use of Mozart to treat learning disabilities, psychiatric disorders, and autism. In the book, he described numerous experiments he had performed on patients over 25 years in practice. And while the Tomatis method is frequently mentioned in papers to the present day, it's largely dismissed by the scientific community as pseudoscience. The paper that really started the avalanche of research on Mozart and its effect on the brain was this study by Francis Rauscher in 1993, where 36 college students were given an IQ test under 3 different listening conditions: the sonata for 2 pianos in D major, Kerschel 448, a relaxation tape consisting of spoken words in a monotone voice, and silence. And they found that with the Mozart, they performed significantly better on the spatial reasoning portion of the IQ test. So this was a major finding that was taken up by the mainstream media, the Associated Press. They were banging down her door. She was on nightly news with Tom Brokaw. And subsequently, she performed more studies. Well, is it any music or is it just Mozart? So comparing Mozart's music to music by Philip Glass and trance music, neither of which had the same effect. And then a study on rats who were exposed in utero and postpartum to hours and hours of Mozart, performed better on mazes for 5 days than their control counterparts. If you were around in the 90s, you may remember seeing displays like this in your local Barnes & Noble. Everyone was very excited at the idea that Mozart could make you instantly smarter and maybe make your babies smarter. So going on in the rodent community, there was a study looking at mice performing mazes. And so they were exposed to 10 hours a day of Mozart or Beethoven's Fur Elise. Again, it was the same Mozart sonata for 10 weeks. And as you can see, the mice listening to the Mozart for 10 hours a day performed the mazes more quickly and with fewer errors, and actually improved more over the course of 15 trials. And this was an effect that was seen for up to 24 hours. The first study to look at the EEG correlate of this Mozart effect was this one, where, similar to the initial one, 7 subjects completed 2 sets of spatial temporal reasoning tasks, like this one you see on the lower right. The first group after 3 minutes of spoken text, and then the second after 10 minutes of Mozart, the same sonata, Kerschel 448. And the major findings on the EEG was that where people normally have activation of their right temporoparietal cortex when performing these types of spatial temporal reasoning tasks, some of them had the addition of left temporoparietal cortex activation as well, and an increase in prefrontal cortex EEG coherence was also seen. So the authors hypothesized that this could represent an increase in synchronization or cooperativity between different prefrontal sites, and possibly mean that there's increased cortical efficiency. So similar to studies that have shown that people who have extensive experience doing a particular thing, like playing a musical instrument or playing video games, the people with experience have decreased brain activation doing that same task than somebody with less experience. Basically, the cortex is more efficient. So they thought that the Mozart might be a sort of shortcut to that effect. the first person to look at the possibility of a Mozart effect in epilepsy was John Hughes. I believe it was 1998, where he exposed 29 conscious and unconscious patients in the hospital with a high baseline frequency of IEDs during wakefulness or even in a comatose state. And 23 of them had a significant reduction in epileptiform activity during the Mozart, including patients in the midst of status epilepticus. He did have other music as controls, old-time pop piano tunes, and Philip Glass again. And as you can see on the left, this is one patient. So they had ictal activity on their EEG for about 50% of their EEG before the Mozart, and then that decreased dramatically during the Mozart, and then increased again once the Mozart playing had stopped. And here you can see a decrease in amplitude during the Mozart and decrease in discharge frequency. And then this was one person's actual EEG. On the left is while the Mozart Allegro, the first movement of the Mozart Sonata 448 was being played, and on the right is during the pause between movements, and you see many discharges, maybe periodic discharges, which were not there while the music was being played. So that was very remarkable. So then further researchers tried to replicate the study. Somebody tried to do a randomized controlled trial on patients with SELECTs, formerly known as benign relandic epilepsy. Only 4 patients, 2 out of the 4 of them had greater than a 25% reduction in IEDs when exposed to the Mozart, but not Beethoven's Furlis. The other 2 had insufficient IEDs to analyze. Then a larger study, 58 children with epilepsy, compared their EEG before, during, and after 8 minutes of the Mozart Sonata, and they saw a reduction in IEDs with the original, but then not when they played them a computerized string version of the same piece. And they hypothesized that it was something about the lower harmonics, more fundamental tones. I question that because it's a computerized version, so there's more variables there. Then another study, a more long-term study on 18 patients who listened to the Mozart for 8 minutes every day before bedtime and remained on the same medication dosages for 6 months. And they saw a significant decrease in the IED frequency at all time points, except for those patients with occipital discharges. And then people said, okay, we keep doing the Mozart 448. Let's try another piece by Mozart, a similar sonata for one piano, the famous C major sonata that everybody knows. And sure enough, they saw a reduction in IED frequency with the Kerschel 545 as well, particularly those with central and generalized discharges. Then at Dartmouth, a few years back, they did a study on 16 patients undergoing intracranial EEG monitoring for refractory epilepsy. They exposed them to 90 seconds of Mozart and Wagner. They saw a significant reduction in IEDs only with the Mozart, only after at least 30 seconds, and only in the bilateral frontal regions. They saw a reduction in IEDs both inside and outside the seizure onset zone. And there was no temporal carryover effect, maybe because the exposure was so short compared to some of the other studies. And then this more recent study looked at whether playing with the tempo would affect the Mozart effect. So they divided 147 patients into 4 listening groups. One was the original Kerschel 448 Mozart Sonata, which is at 138 beats per minute. One was a sped up version, one had a slowed down version, and then one had a control, which was a Haydn symphony first movement, but they said it was 96 beats per minute, so much slower than the Mozart. And they compared the IED rate during 8 minutes before and 8 minutes after a single listening session, and they found a significant reduction in IEDs only with the original tempo of the Mozart Sonata. not the other tempos and not the Haydn. And then just another one recently, a randomized crossover trial. Patients randomized between Mozart and silence. And again, we saw a reduction in IEDs only with the intervention period. So Mozart's music might reduce interictal epileptiform discharges, but can it reduce seizure frequency? Well, first there was this case report of a 56-year-old man with a hypothalamic hamartoma who had lifelong gelastic seizures 5 or 6 times a day, consisting of intense laughter in association with altered perception and experiential phenomena. He had secondary generalized tonic-clonic seizures several times a month and memory impairment. He had heard about the Mozart effect for spatiotemporal reasoning and decided to try it. So he listened to various compositions by Mozart for an average of 45 minutes per day. And during the 3 months of music therapy, his seizures became smaller. So instead of the intense laughter, he had just a small smile, no altered perception, no experiential phenomena, and no generalized tonic-clonic seizures during the entire 3 months. So then this was a study of 25 patients with neurological disabilities and epilepsy and 11 control subjects. This was a 3-year study where the first year was just to establish a baseline seizure frequency. During the second year, the subjects were treated with the Mozart sonata every night during their sleep for the entire year. Every night it was on for 8.5 minutes, off for 8.5 minutes, on for 8.5 minutes, and so on. And then the third year was just to follow up without the Mozart. And as you can see, whereas the control group had an increase in seizure frequency over the 3 years, the Mozart group had a decrease during the treatment year that was sustained during the follow-up year. Then this was a randomized controlled trial of 19 patients randomized to listen to Mozart sonata for 2 hours a day for 2 weeks. The other 10 children were randomized on a set of Mozart's compositions, so various compositions by Mozart for 2 hours a day for 15 days. And sure enough, they saw a reduction in many of the patients with the set of different pieces by Mozart, even a greater reduction than the ones that only listened to the sonata for 2 pianos, Koszul 448. And then this was a study of 13 patients where they had 3 months of listening every day to the sonata for 2 pianos and 3 months of daily listening to a phase scrambled version where they had the same notes but without the rhythmicity. And they saw a significant decrease in seizure count during the treatment period, but not the control period. So the rhythmicity is a key component, clearly. And they saw high compliance rates, which was important to note. So in the literature, there are many hypotheses out there about possible mechanisms of action of the Mozart effect. This is not even a complete list. Could it be just that it's relaxing? It activates the parasympathetic nervous system. Could it be enhanced dopaminergic transmission? Because studies do show that music can, by setting up expectations and then delivering on those expectations, it does affect dopamine levels in the listener. Could it be mirror neurons linking auditory stimulation directly to the motor cortex? Optimized fundamental tones. There's stuff out there about 40 hertz affecting the brain. Long-term periodicity was the theory by John Hughes, who did the very first study on Mozart and epilepsy. He actually analyzed a ton of music by many different composers and found that Mozart had the highest degree of what he referred to as long-term periodicity, which was periods between 10 and 60 seconds, basically in terms of the level of intensity of the music and other factors. So it's divided into these longer term periods. The rhythmicity, as I mentioned, John Hughes also felt that Mozart, the organization of Mozart's music and the long-term periodicity as part of this, resonates the inherent structure of the cortex as represented by the Trion model. And that it is so because he started composing at age 4. And so he had this innate connection to the structure of the cortex, which I thought was very far-fetched when I first read it. And I actually think it's not as far-fetched now. But, and then the idea that listening to Mozart seems to activate the parietal cortex and as opposed to the motor cortex, which is pro-epileptogenic, the parietal cortex activation might actually inhibit those motor areas and therefore be anti-epileptogenic. So these are just some theories. So I read all of this, you know, sort of as a physician scientist, but also as a musician. And I said, okay, I spent 10 years at a conservatory. Let's get back to the basics. I know about Mozart's music. I don't think it's some coincidence that there's an effect. Let's think about what are the characteristics of Mozart's music. So first of all, there is this, for all of the first movements of his major works, there's this clear form that we refer to as the sonata allegro form, where you have an exposition, a development, and a recapitulation. And it has this tonal structure, 1-5-1-1. So in the exposition, you hear the first theme or group of themes like bum, ba bum, ba 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 bum, bum, ba bum, so on. And you know, that will be in the home key. So let's say it's in C major. Then when you get to the second theme or group of themes, that'll be in the dominant of that key. So it would be in G major in that example. Then in the development, it travels through many different keys. You have many different ideas. Then the recapitulation, the first theme comes back, again in the home key, but this time the second theme or group of themes is also in the home key. So that's what that refers to. And that's like, everyone is so used to hearing that. Composers sometimes play with that, but that's the basic form. Then there's this long-term periodicity that John Hughes was looking at. So it basically corresponds to the 16-bar phrases in Mozart's music. So you have a lot of 4-bar phrases, but then you also, it is organized into usually about 16-bar phrases. And then you'll have the larger structure as well. Then there is a steady beat, always, which in all of his, nearly all of his allegro movements, falls right between 120 and 150 beats per minute. Then there is an overall tonal and rhythmic predictability with occasional surprises and frequent mood or character changes. So I'll go over some of that. But so let's listen to the Mozart piece that was used in all these studies. And as I play the recording, I'll point out some of the things I'm talking about. So this is the first theme. It's in D major. Right there, that was the end of the first 16 bars. Now we're modulating, we're going towards A major. So the piece is in D major, we're going to the dominant key of A major. And we're getting to the end of another 16-bar phrase, and now we have the second theme in A major. That was 4 bars. Now it repeats, slightly different. And there you have another 16-bar period. So that was the end of the exposition section, and then it's repeated. Often there's a repeat sign at the end of it, so that's sometimes done. So that was about 2 minutes. The entire first movement, which I'm not going to play, is about 8 minutes long, which is why 8 minutes came up in so many of the studies. Let me go to, no? Okay. So as I mentioned, the tempo in all of Mozart's allegros falls between 120 and 150 beats per minute, which corresponds to, for those of us who read EEGs and think in terms of hertz, 2 to 2.5 hertz. You can also think that the heart rate is about 60 to 90 beats per minute. So this is about double that. And then just to put it in context, so that's the quarter notes are 120 to 150 beats per minute. As you saw, there are many quarter notes and many 16th notes. And this is just to put it in context of other classical music tempos and other genres of music. So, of course, there you find the same tempo range in a lot of rock and pop music and even metal. So it can't be only the tempo. But let's remember that the brain has its own internally generated rhythms. This is a great book that I'm reading that came out about 20 years ago by Yuri Buzaki, Rhythms of the Brain. So he talks about how the rhythms actually provide a framework for all the activities of the brain, and they're hierarchically organized. So the faster rhythms are nested inside of the slower rhythms, and it's actually the interaction between them that is the basis for all of cognition and forming memories. And it's crucial to the way our cognitive processes are organized. So a little bit about the alpha rhythm, that's 8 to 12 hertz. It's often referred to still as the idling oscillation of electrical potential of the cerebral cortex. Now we know that it's not just idle and it's not just the noise, and there's a lot of function to it, but we still refer to it as that. When we read the EEG, we talk about the posterior dominant rhythm as the idling rhythm of the occipital cortex, and that's what we look for first when we open up an EEG to see if it has a normal waking background. Alpha rhythms are dominant at all scalp locations while awake. And during mental activity, alpha tends to desynchronize, whereas theta and gamma tend to synchronize. So long-range alpha coherence falls near zero during mental activity. And you can have contrasting behavior of long and short-range alpha coherence, upper and lower band alpha coherence, and local and global alpha phenomena. So very complex interactions between the alpha and different parts of the brain, depending on what it's doing. And then theta is seen most in the hippocampus and frontal and prefrontal region. The hippocampus uses theta as a timing framework with which it helps to coordinate different neuronal processes and within which new information or experiences are organized into sequences. And increases in frontal theta on EEG are associated with tasks requiring focused attention and or learning, as well as the flow state that people talk about. So some studies have looked at the effects of Mozart on alpha and theta and one found that Mozart resulted in greater desynchronization of the lower one alpha band than Haydn and Brahms. So as I mentioned, you get desynchronization of alpha when the brain is working. So again, the Mozart seems to make the brain work. And it seems to influence the level of attention more than other music, is what the authors said, but with no regard to mood, tempo, or complexity. Mozart also has been shown to result in greater frontal theta in numerous studies, particularly at the transitions after long phrases. So that's what you see in the flow state. So does Mozart help people get into a flow state? There was one study on mice, hippocampal kindled mice. So they gave these mice temporal lobe epilepsy and then exposed them to 12 hours a day of the Mozart sonata as adjuvant therapy, and found that 42% of them then needed a lower dose of valproic acid. So they were subtherapeutic on their valproic acid, but it was more effective. They didn't have seizures. And they found that in the seizure EEGs of the responsive mice, the ones that were responsive to the Mozart, they saw decreased alpha power and increased gamma power. Interesting to note, I'm not sure what to make of that. And so I think it's really interesting that in that tempo range, so the recording I played you was 140 beats per minute, but it's somewhere in there. And again, I mentioned 120 to 150 is the range of all of his allegros. That means that the quarter notes are then falling right in the delta range. The theta notes are, the eighth notes are falling in the theta range, and the 16th notes are lining up with the alpha, falling right between 8 and 10 hertz. And we know from some studies that the frequencies of the brain do entrain to beats that are heard. So similarly to the photic driving that we see with photic stimulation that we do when doing EEGs on people, there is auditory driving as well. So this was a study where patients were, or subjects were played rhythmic patterns. And if you compare the pattern envelope spectrum to their EEG spectrum, you see the exact same frequency peaks. And then when the tempo was doubled and then quadrupled, those peaks also doubled and quadrupled both on their EEG as well. So I have to wonder, as an epileptologist, that frequency range, as I mentioned, it corresponds to 2 to 2.5 hertz. And many of you are probably aware that 2.5 hertz is the cutoff between the ictal-interictal continuum and seizure for the what we consider dangerous EEG patterns, so periodic discharges or rhythmic delta activity. In the 2021 ACNS criteria, you can see ictal-interictal continuum is any of those patterns averaging less than 2.5 hertz over 10 seconds, but seizure is when it averages more than 2.5 hertz for at least 10 seconds. So when you have a pattern like this, if it's static, it's below 2.5 hertz, we are a little worried, but it doesn't meet criteria for seizure. But then if it accelerates, and this is another dangerous EEG pattern with lateralized rhythmic delta activity, if it accelerates to above 2.5 hertz, then that qualifies as a seizure. So I wonder if the Mozart music could be stabilizing the brain frequencies of patients with epilepsy, especially going back to John Hughes's study, even with patients in the midst of status epilepticus, stabilizing it below 2.5 hertz and preventing it from getting into seizure. Then, as I mentioned, there is an overall tonal and rhythmic predictability with occasional surprises and frequent mood and character changes. So there was a study recently looking at what predicts musical pleasure, looking at the chord progressions of many, many different songs. And they found that basically chords induced pleasure if they deviated from expectations. So either low uncertainty context, so basically a predictable music overall, then a surprising chord in that context causes pleasure in the listener, or the reverse, high uncertainty music, unpredictable music, then when you have a chord that feels predictable, that also induces pleasure. And that's associated with activity in the amygdala, hippocampus, and auditory cortex. So I think Mozart really fits the bill there because he has frequent little surprises in an overall predictable context. Now, as a musician, I think that no one can fully appreciate Mozart without listening to and watching at least some of his operas. So I do want to play you about 4 minutes of Così fan tutte. And I'm not going to tell you the plot, and there are no English subtitles, but I just want you to pay attention to the music itself and the things we talked about.
Vi presento amici miei, non dipende che da lei consolare il vostro cor. Per la man che io faccio, e due rami grazia beni, qualche volta me sereni, ecco l'istante, fa con arte, io qui m'ascolto. Ragazzaccia tratto che fai lì così gente, ragazzaccia tratto che fai lì così gente, così gente, così gente. Fai uscire continenti, continenti, continenti. Non ti può venir con loro, non ti può venir con loro, non ti può venir con loro. Sospetto, e la rabbia, e che fu l'amor.
So I have one patient who is very interested in the possibility of music affecting her seizures, and she has actually noticed it herself. She listens to a lot of different music, and she told me that Mozart has gotten her out of a seizure at least once. So I've spoken to her about it, trying to get her perspective on how she perceives this effect to be taking place. So I recorded her and just want to play a couple clips.
I can feel like this sensation in my brain. Like, it's weird. Because when you have like seizure activity, you can like feel it kind of building. I don't know, like it's so weird to describe to people. It sounds crazy, but like I can kind of feel it. And the best way I know how to describe it is almost like a pressure. But when like I have like the music playing, it almost feels like a wet blanket of sorts. Like it kind of like tampers it down a bit at first, and then it's like a calm wave. I'm trying to remember.
There tends to be these dead places within the music where even if there's like instruments playing, it gets pretty monotonous and repetitive, and you're hearing the same thing over and over throughout the music without a new kind of anything in the background that's bringing your attention to it, and it gets kind of boring. It's the best way I can equate it. Your brain gets kind of bored of it, versus when you're listening to Mozart, even when it's in those deadpan moments, there's something new that brings your brain's attention back to the piece. And I think that keeps your brain a bit engaged with what's going on, and keeps it from basically just zoning out.
I thought that was so interesting when she said that, because that was basically my theory, is even if it's not happening consciously, that the music it has this consistent rhythm, but it has enough of these surprises to keep the brain engaged so it doesn't just fade into the background.
Because I think like some newer composers, if I'm to listen to that music, the beat can be similar to Mozart's, but even with that beat, there's something else behind that music when Mozart's composing that piece compared to like newer people. The newer people, it's just that one beat track that's present, versus his, where there's something else in that background and it keeps you focused on what's happening. Even if it's just playing in the background, your brain is able to kind of pay attention to that. So one, the engagement of it without making it feel like it's overworking your brain, as other pieces do when it gets loud and busy and there's too much happening. Even when Mozart's pieces are very loud and engaging from a lot of percussion or other instrumentals being brought in the orchestras, even then it's not overwhelming to the senses. He seems to find a way to have that madness rhythmically placed. He's just a mathematician, both in math and music, and I think he tied that together, and that might have something. There tends to be these dead places.
She also said once, when I wasn't recording, that her brain after listening to Mozart feels similar to after taking a nap. So yeah, I have to say that unfortunately this is not an established science or an established fact, the Mozart effect on epilepsy. There have been 3 meta-analyses. The first 2 said that there was an effect, but the most recent one said that they were very negative. There's no meaningful support for a beneficial effect on any medically relevant conditions, let alone a Mozart effect for epilepsy. Unfounded authority, underpowered studies, and non-transparent reporting appear to be the main drivers of the Mozart effect myth. Certainly, all of the studies are very small, and that's a problem. There was a study, just questionnaires given to patients in Utah about a potential mobile app with different relaxation features for epilepsy. And 75% of patients said they would be interested in a mobile app that played them relaxing music that may help seizure control. So even if it's not guaranteed, a potential high patient compliance. And 45% of them said If they had a mobile app that delivered 10 minutes per day of music that may help to control seizures, 45% of them said they could imagine themselves using it daily for 1 year or longer. We are at UMass currently involved in a study. I'm the PI at UMass, together with Dartmouth. It's called the Sonata Study, self-administered, one-of-a-kind approach to epilepsy through a web-based music application. And this is a trial on patients with an implanted RNS device or NeuroPace. So this is implanted and collects EEG data continuously 24 hours a day. And the patients will be listening to Mozart as well as other music, a couple weeks each, and we'll be able to look at their objective EEG data and see not only their seizure frequency, but other epileptiform activity, possibly other differences on the EEG. So very exciting. We're starting to enroll in the next couple of months. So in conclusion, music by Mozart may have an anti-epileptic effect. The mechanism mediating the effect is not definitively known. Music therapy is a low risk and low effort add-on therapy, and patient compliance is promising. And Kerschel 448 is only one of over 600 compositions by Mozart, totaling about 240 hours of music. So I certainly don't believe that the effect is limited to this one sonata that just is used over and over because people are afraid to change it. But I would recommend, to prevent any sort of habituation or desensitization of the brain, I would recommend people listen to a lot of different music by Mozart. So if you listen even for 2 hours every day, you would hear each piece only 3 times a year. And that's it. Thank you. Questions?
Dr. Erlich-Malona, thank you so much for a wonderful, wonderful talk. Absolutely fascinating. I'm going to open the floor to anyone from the audience with their questions.
Wrong. When you're ready, give it another try.
And if not, I'm happy to start the dances here. And you were talking earlier on during your talk of some speculation exactly why Mozart stumbled onto this line of sonatas essentially that have this effect on the brain. I'm curious, culturally in different societies, in different cultural milieus, if you will, whether other kinds of music have been studied or have a similar effect, or whether conversely Mozart's music has been studied in, let's say, non-white, non-Western institutions and scenarios.
Yeah, it's a question that comes up a lot. Obviously the question is whether the expectations in Mozart's music, like whether it sounds good to Western ears because it's, we're used to it in the West, and maybe that's playing a role, and maybe people who are not in the West, who are not used to hearing that type of music, wouldn't have that effect. I don't know of studies really being done, but I think it's important to note, how much Western classical music has taken hold in Asia, despite it not being part of their culture originally.
That's fascinating. My wife also, who's an epileptologist, has a question.
Have they looked into, hi, I'm Izzy, I'm one of the epilepsy
Hi.
fellows. I also play piano, so I'm familiar with Mozart's works. Have we parsed out whether or not it's the harmonics versus the rhythm? Like you showed earlier that with the string version, obviously it didn't really have the same effect, but have we separated out, like if we were just giving them a drum beat in the same like rhythm and cadence of a piece, would it have the same effect if it's sort of like the auditory driving that we were possibly thinking about?
Yeah, I don't think anyone has done the rhythm without the tonality yet.
Because that would speak to like changing it to the harmonics of, an Asian-based the pentatonic scale, the other scale, uh, compared to like the traditional scale that Mozart plays under. But I think we had another. It's interesting because we had another person who's a musician, Dr. May Rui, talk about her work looking at
Yeah.
the effect of music on patients in the OR and how music with surprises actually was detrimental to patients because of like the unpredictability in that piece of music actually had a correlation to like higher blood pressures and like more instability from an autonomic standpoint in the OR, interestingly. What are your thoughts
Yes.
on that in relation to like the surprises in Mozart's pieces?
Yeah, well, it's interesting. So, they're looking at basically the goal is explicitly to relax people in the OR before they're going to have surgery. And they're looking at their heart rate and blood pressure. So I think it's a little bit different, and the type of music that's effective for that, even within Mozart's music, might be different. Like slower tempos might be more effective for that explicitly to relax people and activate their parasympathetic nervous system and lower their blood pressure and their heart rate. But that might be different from the anti-epileptic effect.
Which might not necessarily be a relaxing effect.
Right.
Interesting.
Fascinating. Next up, we have a few questions that have come up. So Amar is asking, if we understand the composition of Mozart's music, why can't it be replicated by following the same rules?
Yeah, and my husband, who's a scientist, said the exact same thing. I got very angry at him. I said, "Yeah, sure. Why don't we just compose music like Mozart's? Like nobody's been trying to do that for 300 years." No, I mean, of course, in science, that's what you do. You figure out what is causing the effect, and then you try to replicate it and optimize it. And people are certainly trying to do that, and trying to use AI to do that. And I wish them luck. I think that I'm like still a musician at heart, and I think that there is something about Mozart's music that nobody has come close to, and um, and that maybe that is the same thing that has the effect on epilepsy.
Yeah, it's one of those areas where the humanities and the arts, have been at it for quite a while, right? Terry Schrader is asking us, what are the similarities or differences between the use of entrainment for stroke rehabilitation using rhythmic cues to help the brain synchronize motor responses and the entrainment of ECG for reduction of seizure? Maybe he meant EEG, maybe.
EEG.
Yes.
Yeah, I mean, honestly, not that much has been done looking at entrainment, auditory entrainment on the EEG. I'm surprised I didn't find more on that. And then stroke is a whole other area that I haven't read that much about, honestly. So, Terry, we should look into that together.
And then Sakina Batul is asking, hi, thank you for the very enlightening talk. I'm an incoming PGY2 and wanted to know if it was studied, if there was a difference between the effects of epileptics listening to Mozart when conscious/aware of them being studied for this effect versus spontaneously when they would be unaware of this intervention or observation. As in, do we know if their awareness of using music as an intervention change the effect this has on them?
Right. So, I mean, that's something in our study that I worry about. I'm like, oh God, this patient, I might want to enroll them. I definitely can't mention the Mozart effect to them. And then, what if they have already heard about it independently? That could affect the results. But, many of the studies that I showed were on children with epileptic encephalopathies, people with intellectual disability, and there were also patients in a coma. And many of them were exposed to it in their sleep. So I think many of the subjects in the studies I talked about, were not aware of the effect. And some of them were not even aware they were being exposed to the music because they were unconscious.
Absolutely. And then I think we have time maybe for one or two more questions. And Amar is again asking if the cortical areas that the music stimulates can be detected, can it be targeted using other modalities like TMS or RNS or even DBS? Sort of using music, I guess, to investigate which areas we should go after.
Yeah, possibly. It's a good question. All of it should be tried.
Right. If anyone has one more burning question, we can address it. Galina Geichmann, go ahead.
I had a quick question. Natalie, thank you so much. I was really interested about the fact that it actually seems to increase attention and to increase focus, partly because probably of these like inconsistency that so you can't really drift off because something keeps bringing you back, and your patient mentioned the same experience about
Yeah.
like, and I wonder if there's been any work in looking in like ADHD, because I know when we think about attentional disorders, I have some friends who've been very open with me sharing their experience, and they've said sometimes what helps them focus is having more things going on. So like one of my friends, like she both focuses when she's like playing a game and on one side and then like doing her work on the other, and it actually somehow reaches a peak level of attention that she needs for performance. And I'm just curious if anyone has looked at that, and just it just reminded me of this sort of anecdotal experience that she shared with me.
Yeah, I can somewhat relate to that. I haven't seen any studies specifically on patients with ADHD. I'll have to look.
All right. Maybe one more fascinating discussion also on ADHD. I thought it was really interesting. So Cassandra Mulcahy, who's also a music therapist and gave us one of our boosters a while ago, asks, are there emerging technologies like EEG, wearables, AI-driven music analysis that may help us better understand which musical features are therapeutically relevant?
Yeah, I think some of the studies that May mentioned in her talk, they're working on doing that apparently, like really pinpointing specific musical features to then try to produce that music with AI. So.
Yeah, we can send out the recording of that talk as well. Well, thank you so much, Dr. Erlich-Malona, for an incredible talk, and thank you everyone for being such a captive and energetic audience. Stay tuned because we have some announcements for you all. Alina, what's next?
Well, I'm just going to use the last minute just to ask everyone for their attention. We should probably play some Mozart music so that we get higher responses. But we're really excited to share that we were recipients of the 2026 ANDI Innovator Grant, and we are proposing to launch a Depicting DI series. So we're really going to use the engine of the NHN to continue to bring you seminars and boosters, but focused over a 6-month period on really looking at diversity, equity, and inclusion, and what that means at the intersection of arts, humanities, and neurosciences. We want to hear from you. What do you want to learn about in those 6 months? There's so many topics, definitely more than we can fill 6 months with, but we're putting together a survey just to hear what we should prioritize. So please take a minute and hit the link in the chat, or send us an email with your thoughts. But we really want to prioritize what this community wants to learn and hear about. And I think, Natalia, the next slide may even have a QR code. So for those ready with their phone, go ahead and grab that QR code and let us know what you want to hear about in the series. And shout out to our newest members, Natalia, who's on the call, and others who are helping us with this campaign. And if you enjoyed what you heard tonight, join us next month. Our next seminar will be with Dr. Jorge Clifton Correa. We'll be looking at birth brachial plexus injuries as seen through the eyes of Northern Renaissance artists. So we've tuned our ears. Next time we're going to tune our eyes. Come and join us on July 15th, our usual 8 to 9 p.m. Eastern. And thank you so much. Hope to see you all there.
Thank you, everyone. Have a good night.
Thank you.